Welcome everyone to our first lecture, What is Global Health? Lesson 1.1. Thanks for participating in the Padlet activity on the words, pictures, comments that you think of in terms of the concept of global health. I will share our final Padlet once everyone has had a chance to participate. Remember to have your template handy to take notes as we move through these different health disciplines. So we're going to start off with what is global health and where did it come from? This was a picture I uploaded to our Moodle for lesson 1.1, looking at the different health disciplines. As you can see, public health is quite predominant, but global health is coming up as a quick second place behind public health in terms of looking at journal articles and who is publishing on what and the terminology that they're using. Also, you will see a declining in the terminology of international health, but also coming on the forefront in journal articles now is the concept of One Health and planetary health. So you will see as we move through our 12 weeks, we will focus on the term global health, but you will also see many articles and many websites that we look at may describe global health as public health or international health, or maybe One Health or planetary health. And we're going to look at all of these. So global health. Global health emerged as a new concept arising from the earlier disciplines of public health and international health. Where did public health come from? So let's start there. Public health emerged in the mid-19th century, specifically in developed countries, or at that time they were developing, so England, Europe, USA, due to deplorable living conditions, low socioeconomic status, poverty, infectious disease, high mortality rates. And there was a focus on what was happening in society. There was a focus on infectious diseases. There was a focus on social reform movements, so looking at society and is society causing some of these high death rates and high infectious rates. There was also a growth of biological and medical knowledge, so germ theory, the introduction of penicillin. The environmental theory, developed by Florence Nightingale in the second half of the 19th century, focused primarily on the environment and the influences that the environment has on life and the development of an organism, and that the ability to prevent, suppress, or contribute to disease or death. So what environment can do in the cases of, can we look at the environment and prevent death? Can we suppress it? And Florence Nightingale also developed the link between environment and disease and started to collect data. So the importance of data collection. Public health is focused on improving human health from the population perspective. While clinical medicine focuses on individuals, public health operates at the population level, investigating and preventing causes of death and ill health. One definition of public health is fulfilling society's interest in assuring conditions in which people can be healthy. And this is from the Institute of Medicine report. Tracing modern public health roots to the 19th century, we can look at what are the four main factors that define public health. And this was in one of the articles that I'm going to list this week by Jeffrey Copland, a 2009 Lancet article. So public health is about decision-making based on data and evidence. So looking at vital statistics, surveillance, outbreak investigations, laboratory science, so that real link between data and evidence. Again, while clinical medicine focuses on the individual, population health operates at the population level. Public health, operates at the population level. Public health has a real sense of a goal of social justice and equity. And there's an emphasis on prevention rather than curative care. Where do we see public health? Well, an interesting debate has recently emerged around the scope of public health. Many argue that public health has a domestic, country, or community focus, and that is one of the defining features that separates it from other healths. Others argue that public health is an overarching concept that permeates and governs all health fields, including global health, One Health, and planetary health. So, in the latter case, global health would be public health applied to a transnational health issue. And so, one of the things that you may think about is that when you come in contact with someone who works for public health, ask them what they think public health means. So, public health in action. The smoking and lung cancer connection provides an excellent example of public health. Decision making was based on data and evidence, so a lot of information came forward about the link between smoking and lung cancer. So that was the data evidence. There was a focus on populations rather than individuals. There was an emphasis on prevention rather than curative care. So looking at what was done in public health. So increasing the taxes on tobacco products, prohibition of smoking in public places, counter advertising, putting cigarettes behind a barrier when you are buying them or when you're walking into a variety store, what have you. So that is a great idea of public health in action. So back to global health, let's look at international health now. So what defines international health? For decades, it was the term used for health work abroad with a geographical focus on developing countries. There was a real strong focus on infectious and tropical diseases, water and sanitation, malnutrition, and maternal and child health. And there was a real divide between us versus them, and that these health issues were happening all over there, all over in a different country, and they weren't happening to us at all. International health then stresses more the differences between countries than the commonalities. But something happened in 1980 when the AIDS epidemic hit. Things started to change. Many people came together around the world and really fought for AIDS because AIDS was not only happening in developing countries or continents like Africa, it was actually happening in our North American states and provinces as well. So there are authors that would say that AIDS really invented global health. It disrupted the divide between prevention and treatment. There was a real focus on prevention, so education and condom use. There was new forms of disease advocacy and activism. There was new global funding that came from many countries. The cost of essential medications was changed. It really recognized human rights. And it was a major boost for global health research and academic interest. So global health took us from the us versus them to the we impact. And so that was a big part of global health, is looking at these health issues are happening to everyone around the world, no matter where you live. And its power is really well recognized and enthusiastically supported by governments and private philanthropic organizations like the Bill and Melinda Gates Foundation. So what makes something global? I want you to think bigger. Must the global health crisis cross international borders to be deemed a global health issue, such as HIV, SARS, COVID right now? I want you to think of global health as more than just an epidemic infectious disease. And that there are no boundary limits, and that we should not restrict global health to health-related issues that literally jump and cross international borders. And so the global in global health refers to the scope of the problem and not their location. So global health is not only about health in developing countries or infectious diseases, it is, but it's also about health-related issues faced by the human population as a whole. So I want you to take a picture of this QR code. It's going to take you to another Padlet, and I want you to list some ideas of what you think are some global health issues faced by the human population as a whole. Some of the things that I think of are climate change, urbanization, tobacco control, chronic diseases. I'm going to leave it open to you to think of some global health issues faced by the population as a whole, and then I will share those. Global health is achieved through prevention and/or treatment and care of populations through the sharing of knowledge, resources, and experience across cultures, societies, and international borders. So globally, we're all working together. So what is it? It's based on a population level. It's preventative, but it also looks at curative and rehabilitation. It looks at poor, vulnerable, underserviced populations everywhere. It's interdisciplinary. It looks at health as a public good. It also looks at the health systems and structures. And we see this in developing countries that were hit with Ebola, in that they were unable to fight Ebola because of their deplorable health systems and structures. And it also takes into consideration several stakeholders, and we will discuss looking at stakeholders in global health as we move through. So what is global health? It embraces the health threats that affect all of us globally, and its ultimate objective is health equity for all nations and all people regardless of where you live. Global health is global nursing, and we are part of that interdisciplinary field, and as nursing, we represent the majority of healthcare providers worldwide, and we are critical to the Global Health Initiative. And that is why this year, the International Council of Nurses and the World Health Organization has deemed 2020 the International Year of the Nurse and the Midwife. So stay tuned for one more description of two other health disciplines. We will discuss planetary health and One Health.